to this computer. Okay, so the reason why we're having this kind of this call right now is because basically Camille was a superhero, and we had our first pretty catastrophic vascular occlusion. And what happened was it was an employee that what was treated. Obviously, the current, I guess, benefits are pretty murky from what it sounds like of kind of what people get and what people don't get. And so he didn't pay anything. But not only that, he also did not sign any consent and originally did not have a chart until the injector had realized that there was an issue and then went back and created a chart. Camille, is that accurate from what you know?
Whoops. Yes.
Okay. Okay, perfect. So we have because this directly involves all of us, we are the kind of engine behind the employee benefits for injectables. So it really is going to base on what we all decide. Admin can decide, this and that, but at the end of the day, the injectors have to be comfortable with whatever we decide because we are the ones that are going to be injecting and offering up our services and our talent for a significant discount off. So we're going to kind of discuss this, and we are all going to come up with a plan that we deem that is appropriate. So, y'all all on board with kind of the purpose of this call?
Yes.
Okay, perfect. Y'all, anyone have any questions? And I'll let Camille kind of go into the specifics of the VO because I can't stress enough of how heroic her actions were, of what happened. So, Camille, if you want to kind of break everything down of what happened and what occurred, this is your kind of shining moment because again, I think what happened is every single injector's worst nightmare. It was not Camille's patient, but it's every single injector's worst nightmare of what happened. And she handled it with professionalism and with grace and truly made a life altering service to this patient. So go ahead and Camille, you can say what happened. You don't
Um,
have any names though.
sure. So he was injected on a Tuesday, lip filler, and reached out on Wednesday morning with rather severe swelling in one area, lots of pain, of which she was told it was normal. No one really checked and supervised or laid hands on. And time went on. I think he went to visit his family, so he really wasn't around, but kept updating the injector of what had was transpiring to the point where I believe it was Saturday or Sunday, he went to the ER because he was in so much pain and started developing sores on his upper lip and then right inside the lip, two separate sores. And they told him it was an abscess. They did not drain it. They just put him on antibiotics. He was having vision problems. He started to see blurriness, little white or black spots in his eyes, floaters, lots of pain still on that side of his face. When he came to me, I guess it was then a week later after being injected on Tuesday, he had, I would say, stage 4 VO, which had started to go up to the angular artery. You could actually see it blanching up the side of his nose, massive open sores on his lip and above, and extreme pain, still having really bad blurry vision. So I went in and flooded the area. Um, we Dopplered the area to make sure that everything was patent after. And actually, immediately, right when I was injecting the spot, he was like, "Oh my gosh, my face feels so much better. This is like the most relief I've had in days." And vision, hopefully, is okay. It came back, no issues. All his acuity tests were fine. He is going to go see an ocular specialist, and it seems to be healing really well. The sores are closed, healing well, but scary.
Yeah. Do y'all have any questions for Camille or for me about it? It's a great learning, something that we can all learn from. Any questions about it? So I do want to
Well,
go ahead, Jennifer. Sorry.
oh, sorry. I'm sorry. I'm just curious. Like, I haven't had a VO before, but I know, everyone says it's not a if, but a when. So, how much Hylenex did you have to use?
I ended up using 4 vials. So I put one, I cannulated through the top of the lip, like the philtrum columns. I put one in the entire top lip inside his lip. I put one up through the angular artery and towards the infraorbital artery. And then I directly put an entire vial in the facial artery, like aspirated, make sure I was in there and put a whole vial in there.
So Jennifer, kind of rule of thumb for Hylenex. So one syringe of normal non-Vicross filler is in general 2 vials of Hylenex. 150 milligrams is in 1 vial, just 1 ml. So it's traditionally 2 vials of Hylenex will dissolve 1 non-Vicross syringe. Unfortunately, the product that he had was Volure, right, Camille? Was it
It
Volure?
was Fabella.
Vobella, I'm sorry, Vobella. And so with the Vicross products, it's 1 to 4. So that's the reason why she had to use 4 is because the Vicross technology is a lot tougher for the Hylenex to break those chains. And so it requires more. And when you are using Hylenex in an emergency situation, you never dissolve it. You do not add lidocaine. You do not add bicarb. You don't do any of those things. It's considered an emergency situation. And so you need concentrated Hylenex in order to dissolve it for patient safety and the health of the tissue. As far as phases of a vascular occlusion, not everyone's familiar with it. So phase 1 is going to be that initial blanching. The skin is going to start to turn white. The reason for that is because the tissue is slowly starting to get stressed out and it immediately turns white. When you are appreciating capillary refill, you have to do both sides. You can't just do one side at a time because that doesn't mean anything. You have to compare it. So if you do ever have a VO, compare it to the other side of the face to see if the capillary refill is decreased. So that's phase 1. Phase 2 is going to be, it looks like a reticular lacy pattern. Now you're going to start to have erythema kick in. So you have that blanching still present plus erythema. That is phase 2. Phase 3 is going to be vesicles, and that's probably when he started developing sores. So vesicles, unfortunately, a lot of providers will think that it's just a herpetic outbreak and will put the patient on some Valtrax at that point. Unfortunately, that's not the answer, and it's because the tissue is now starting to kind of break out into these smaller sores. That's phase 3. Phase 4 is going to be that initial skin breakdown. Phase 5 is full thickness necrosis, meaning there is now a hole. The only way for this to heal is going to be from the secondary intention from the bed of the wound up. So there's a total of 5 phases of a vascular occlusion. Each phase in general is 12 hours. So he was at a stage 4. Does that help? Have y'all ever heard that before? Or are y'all like, what did she just say?
Oh, so do did y'all find out like exactly where you think the occlusion happened? Because I know was it the oral commissure?
Yeah, most likely what she did is she probably was trying, she was doing the upper lip, so she was aiming for she probably got a hold of the superior labial artery, but probably injected, you should never inject towards the oral commissures. You always want to inject away from it because otherwise you have more chance of causing a VO if you're going against the blood flow. So you kind of want to make sure you're pushing it that way. So she probably did that and it backed up into the facial where it
And al and also she was probably a little too deep
yeah.
in the tissue. Okay, because usually, I mean, lips are you stay pretty superficial. So
Pretty superficial,
I
yeah.
was trying to figure out how it happened.
Yeah, that's most likely. And then obviously you want to make sure that you're aspirating, especially if you're doing kind of more the belly of the lip. Even with some of like the fencing technique, I will actually still aspirate because I will do a sterile split. So I will crack the syringe through insulin syringes. I think Roger, Roger does that as well. And Justin, I know you do that too. So, it's I don't know what that is. Read AI. That is something that will kind of help.
Oh,
And added read AI. Oh, that's
oh,
from
it's meeting notes.
it's meeting notes, yeah. So that's that will kind of help because you're using a smaller gauge compared to what's on the native syringe. You're less likely to occlude a vessel with that. And obviously, slow, steady pressure. You never want to blow a bunch of product in at a time. So, and he said he didn't have a history of cold sores because I specifically asked him, if they do have any history at all of having a cold sore or herpetic outbreak, you are automatically calling in Valtrex 2 grams PO BID times 1 day for preventative because you do not want them to break out in a cold sore. The worst thing that can happen is you do these beautiful lips and then the next day they break out in a cold sore and now they have some unevenness. So please make sure you're asking about their herpetic history.
And also, I know whenever the first time we met, you were gonna have a VO protocol, I guess, posted. I guess we're gonna have that pretty soon.
Yeah. So I just
Okay.
created the Facebook. It's actually in the collaborative agreements for the NPs and PAs. So Camille has it. It's also, I sent it in to Jill for the employee handbook, but also I'm going to have it on, I added the Facebook page for everybody. And I put the B12 education on there for us as well. So it will also be released in the newsletter as well. But I'll put the VO protocol on the Facebook page and I'll put it in the guide. And so that way it's easy for y'all to find. And so at the drop of a hat, you can pull it up. But also, we'll see if y'all can print it out and then have a hard copy in office as well. And the front office staff can do that for y'all. And it's pretty specific. It's like, okay, blanching, stop injecting. You're going to set your phone and alarm and you're going to massage for 5 minutes because 5 minutes can seem like a long time, especially when your butt is puckering when the lip is white or whatever you're injecting. So you're going to massage for 5 minutes because it's either an interarterial or it might just be a small compression and you're just too close to the vessel. And massage can kind of move that product around if needed. And then it will kind of break it all the way in and it takes it all the way down to hyperbaric treatment, which is actually what we end up doing with the patient as well. He's doing 3 rounds of hyperbaric to help with wound healing.
Um, Maybe when you are in Atlanta, can we do like a mock VO,
Absolutely.
kind of like ACLs?
Absolutely. Would y'all want to all do that together, maybe?
Yeah. I mean, I'm down. Like, I'd rather. I mean,
Yeah, absolutely.
Yeah, it'd be
it's just
fun.
one of those things. Like, it hasn't happened, and I know what to do, but I definitely would want to like kind of know where everything's at when it does, and not feel like a chicken with my head cut off.
Yeah, absolutely. And we have a whole team behind us. Like I deal with here in Texas, I have a whole part of my company that does just VOs for other companies. So we kind of fix other companies' mess ups. And so I'm really experienced with VOs, unfortunately, because there's a lot of crazy things that are happening out there. But my brain is yours. So anything that y'all want to learn, I kind of did some basic training with Camille on the ultrasound. And so we'll make sure that we can try to get y'all at least pretty comfortable with using it. And so anytime I'm at any of your shops, I'll let you kind of play with around with mine and we'll look at in the future of trying to get more ultrasounds, at least at a shop just for safety purposes. And that would not be for ultrasound guided procedures. It would be more for education and for emergencies. Okay, so any questions before we move on to the other reason why we're here?
Just one more. Was the patient in pain like immediately after it happened? Maybe.
I'll let Camille answer.
Oh, okay, sorry.
Yeah.
This thing is so hard to work. It didn't sound like immediately when like she hit it and you went, whoa. I don't think that happened as far as I know, but the overnight he was
Overnight, okay.
severe pain and then swelling. Worst case, just dissolve. Say, I'm sorry, I'll pay. Just reach out to the Allergan or MERS and get another syringe covered and say, this is what
Yeah,
happened. Normally they will and just cover your butt. I don't know. It's
yeah.
terrified me. I think that I will always do that now.
If you ever do have that and you do have to dissolve, you obviously dissolve everything. You don't just dissolve part of it. So like if you're dissolving, if you do get a small little, even if it's just like a little compression VO or something, and you do elect to dissolve, use the whole vial of the 150 of undiluted Hylenex, dissolve the whole upper lip if that's the area where the concern was. And then you have to wait 2 weeks before you can go back and refill. And then obviously we would reach out to the reps and we would comp that syringe for them. All right. Okay. So let's talk about injectable benefits for employees. So we have a lot of different ways that we can do this. Ageless does it a little differently because their injector is salaried. And so she's kind of compensated for it regardless, where several of y'all are commission only. At the end of the day, when we do free services, we can totally say, oh, we're not going to pay the injector, but whatever we decide is going to be taken across the entire platform. And we are going to run into injectors who are not willing to inject for free. So we need to kind of come up with something that we think that is fair for all injectors, because we can't ask someone to do a service for free, especially if they're in a large surgery center and they're the only injector and you have 200 people wanting to get services, including all of their family and friends for free. So let's kind of break this down of what is kind of on the table. So let me pull it up. So the current one for SSA is, Camille, remind me, how many is it? 4 syringes and then unlimited Botox?
Sorry, yes, 4 syringes, unlimited Botox.
Okay.
And cost of lasers, lights.
It's cost?
Like cost of whatever we have to pay, tip
Well,
or
it's like a staff cost, I guess.
staff cost.
Yeah, it's like just the consumable.
Mhm.
Who did I send this to? Oh, here we go. Okay. So for lights and lasers, so what percentage off? Because if it's the estheticians, obviously they can do that kind of work, but if it's us doing it, we have to be compensated. Not only that, the company still has overhead costs, such as medical malpractice insurance. Obviously, medical supervision goes into that. The EMR goes into that. The needles, the disposal, the admin overhead. So there is cost associated with any procedure, even if it is an employee. So we need to come up with a certain percentage off that we all think is fair and that where the injector is getting compensated as well for this. Okay. So for lights and lasers, let's just open up. I'm throwing out 75% off of lights and lasers. And y'all can say, absolutely not. I love it. It needs to be higher, lower. I'm throwing something at the wall as a starting point.
Well, I would say like an IPL, that's like it could be like $35. So the total price has got the compensation for the whoever's doing it as well.
Yeah, it'll be your percentage. So if your percentage is 20% on gross, it would be 20% on gross is your compensation. Because we got to talk about, because you not legally, I shouldn't say legally, ethically, medical personnel should not accept tips. It can go against our license for us to accept tips. It can be viewed as a kickback and it can be viewed as a conflict of interest. So people should not be tipping us. That would be like the equivalent of you tipping your OBGYN for a great pap smear. So it can't just be tip based because we also don't want someone coming in and you taking 2 hours to do a BBL on them and then they tip you $20. That's not cool either, right? So we don't want to create animosity among the staff. And so we need to make sure that y'all are compensated and I need to know what y'all are comfortable with the compensation for it. So we want to start with IPL. Like what does that cost for IPL in general?
So I think they run an IPL right now for us at 15. I think y'all can correct me, but I think that's just like bland treatment. Where laser hair removal, I want to say is 15 to 20 per area.
$15, $20. Laser hair, it's $15 to $20. That's the patient, what they typically pay now, like a full paying patient.
No.
Oh, that's for staff.
Yeah, that's staff. So IPL right now for patient is full face 340.
340.
340, something like that.
Okay, I'm getting calculator, like an old school calculator, because that's what I do. $340 times 0.75.
you'd be looking at like $88.
Sorry, I'm adding everything up. Okay, why is this not coming? Okay, so if we did 75% off, that means that would be $255 off. 40. So that means the patient would pay $85. And at 20% commission, that's y'all making $17. Are y'all comfortable with that? Do you want it to be less? Do you want it to be more?
I mean,
When you start putting it that way, y'all are like, "Ooh, shit." Yeah. And remember,
I don't do any lights and lasers on anybody, so I don't really have a comment on that.
okay. Because whatever we decide is going to be taken across the platform. So we'll be deciding for future offices as well for their NPs, NPAs, and RNs. Do y'all feel like that is appropriate? You want me to do a different percentage and see what that number is?
yeah.
Yep. Okay. Well, you want me to do 55% off? Start there and see what that is?
Maybe like, what did we say, 75?
I said 75, yeah.
Yeah, let's try that.
55, are y'all good? Okay, let's do 55. So 340 times 55, that would be $187 off minus the 340. That comes out to the patient paying 153, and then on 20%, that would bring y'all's commission to $30.
They keep it at 75. I don't know. I don't want to take advantage of staff members, and also we use their before and afters always. I don't know. That's just my personal.
Are y'all good with around those two numbers though? So you don't want to go more than 75?
I think 75 is okay.
Okay. Okay. Are y'all comfortable with that? I mean, great. Okay, so the staff member will pay $85 for an IPL. So that would be 75% off. Yes? Perfect. Okay. Laser hair, what do they currently pay right now? Patients. What do patients currently pay?
It's different per section.
It's all by body type and every body area.
What would be the most expensive? Let's just start there then.
Gosh,
Like a back.
I want to say somewhere 300s, 349, 329, somewhere around there.
How about I say 345?
Yeah.
That if someone wanted like full hair, if someone just wants their armpits, obviously it would take y'all 2 seconds, but we'll say it's a large area. So $345. And is that per session? Okay. You want me to start with 75% off as well? It's going to be around that $17 again.
Okay.
Could you do like a flat rate for like lights and lasers? Like it's $25 or $150 for a syringe filler?
No, it has to be a percentage, yeah.
Okay.
Yeah, because the reason why, because costs might change in the future. Okay, so 75 off for 75% off, which is significant. I mean, it when you really kind of look in the big scheme of things, it's significant. Okay, so 75 off lights and lasers, halo. Are y'all all good with that? Because I mean, it's going from like nothing to at least something now, and it's definitive, and it's at least it won't be it won't be gray anymore. It'll be very kind of black and white. And plus it will increase y'all's register and increase your paycheck too, which is really what we're wanting. And again, if someone wants to tip you and hand you a 20 or hand you 100 or whatever, cash on the side, totally fine. We're not going to be rude and say, oh no, I can't accept tips or anything. But we just don't want the front office staff being like, oh, I'm going to put on your credit card. How much do you want to tip the provider? That's kind of where it gets a little shisty. Okay. All right. So let's talk about toxin. So for toxin, we can do anywhere between, again, that 50 to 75% off. So let's say full face toxin is $600. Do y'all agree with that?
Mhm.
Yeah. Jennifer, you agree as well, Chantel?
I'm sorry, could you repeat that?
Yeah, for full face toxin, are y'all seeing usually on average around $600 for full face? Maybe 650.
Yeah, that sounds about right.
Camille, you agree?
Yeah, if not a little bit more.
You want me
Yeah,
to
like
say 700? And this is just for our numbers because we're trying to see what y'all would get compensated is really what it's boiling down to. You want me to
Since we went up to $12.99, it's I want to say it's maybe close to 7 to 8.
Okay, so for at what $13 times, we'll say, I mean, on average 50 units. I mean 40 to 50 units, unless someone's doing masseters or platysmal bands and things like that.
Oh, I'm sorry. I was thinking like full face, like from forehead to neck.
Oh, my bad. I'm sorry. I meant just like the
upper
standard,
face.
yeah, like glabella frontalis, brows, maybe a lip flip and eyebrow lift or something.
Oh, yeah, yeah. Then you're right. Yeah.
Okay, so 600. Yeah. Okay. And again, this is just for our math purposes, so we can do this. Okay, so 600. Do you want me to start at 75% off or 50% off?
Yeah, we can start at 75.
Okay. So that would be $450 off. So the patient would pay $150 for full face toxin. And so y'all would make 150 times 0.2, $30.
I mean, I'm good with that.
Okay, that's $75. Okay, and then let me do 50%, or I'll do 55% off. 600 times 0.5. That would mean they would get $330 off minus 600. Patient would pay $270. Two. That pay would be $54. As Camille takes a drink, she's like, oh. These are hard conversations, aren't they?
I mean, I really don't mind like doing it for other employees. Like, it's not like we're trying to
Yeah, I agree. I'm
rent with
happy
it,
with 75.
Yeah, that's fine. I'm good with it.
Yeah, I agree with Roger. I don't mind either, but I know Camille probably injects a lot more employees than we do. It's not really, but I don't mind. But also, side note, some of the physicians are getting their own Botox. I don't know how. I didn't tell you that, but they're also injecting staff members, so that also needs to be addressed because they
Oh yeah, that is true.
them too.
That's not great.
Yeah.
It needs to have a lane because it has to be tracked, right? I mean, and like I know that and if they wanted, like it has to go through the right channels. Y'all are the injectors, like, and so it's going to be very like that can't happen anymore either, right? Like we can't just have a physician come and grabbing a bottle of Botox and taking it home and injecting his best friend's dog.
Mhm.
You know,
And I don't think they take our Botox. They get it elsewhere, or sometimes they will use it and put it in staff, but that's just another thing that needs to be addressed.
another call. Okay, so 75% off. Okay, and again, we're making this call for, future people. So again, if the staff wants to tip on top, they can hand you cash. It just can't go on their credit card. Are y'all okay with that?
Yeah.
All right.
Yes.
We'll say 75% off of that. And same thing for filler. Y'all want to say 75% off filler as well?
Yeah.
Okay. Well, this is going to be easy. What about weight loss? Weight loss, IV, B12.
That's trickier because we get paid 5% on that.
Really?
I absolutely hate weight loss.
Amen.
Okay. Okay, then we'll put a pin on weight loss. Yeah, we'll
We
put a
already
pin.
don't make a lot of money on it anyways.
Yeah. Okay, IV and B12. So B12, I'm probably going to price it between 35 and probably $50 a pop, which is pretty standard. Justin, is that kind of what you've seen in the Nashville area is between that price?
Yeah, the Nashville area like range from $20 to $45, just depending on like how often they come in and everything. If they buy a package, they sometimes like group it down a little bit more. But just singular shots is around 35 40.
Okay, I'll say $35. I mean, I think that's pretty,
I think that's comparable.
okay. So $35. Obviously, it's just an IM injection, but it still takes time. So 35 times, and we'll say 75% off as well is $26 off minus 35. And the patient would pay $8.75. And on the 20%, we would make $1.75. Are y'all comfortable with that, or do you want me to change that one to 50 because it's such a small fee?
It's a shot.
You're like, it's just a shot. I don't care.
It's like I do this for fun.
Like that could, I mean, it could be at Maria's, whatever.
Say it again, Justin. I'm sorry.
I said at most, like the last place I worked, the B12 shots were free for employees.
Okay.
Because of how minuscule it is, but I'll say the cheapest it could be the best.
Okay. All right. I mean, it's just that takes 30 seconds, but I mean, at least it's something, right? So if you had, because also we need to talk about, well, actually, we'll leave there. Okay. So are y'all good with across the board 75% off?
Yes.
Okay. And I will take this to admin. Obviously, they will, say yay or nay. I will push, say this is what the injectors are comfortable doing. And we can kind of go from there. Second thing we need to talk about is when we inject these employees. So do y'all want them after hours only? So now you're staying after hours, or do you want it during your working hours?
I think if you didn't have a patient scheduled and could come down and do it and they were on a break or clocked out, I don't mind doing it during the day. But otherwise, like it'd have to be like after your day's over, I guess. But as long as you have time, available and you're willing to do it and they're clocked out, I don't see why we couldn't do it during the day. So we don't have to stay, but
yeah, I mean, ideally, I would say during your working hours, because in all honesty, I'm not staying until let's say my shift ends at, like on my last patient's at 3 p.m. and they're like, hey, I don't get off until 6. Can you stay until 6:30 to do my B12 injection? Yeah, no, girl. So ideally, I would like it to be during y'all's working hours. So we're not asking you to do anything that you are not being compensated for.
I'm fine with either.
Okay, so I'm going to say during the day then, and they have to clock out in order for that to happen. Y'all good with that? Perfect. During the day. Okay. So if we say this, so I'm going to say 75% off across the board with everything. Let's talk about the cadence of this. So for toxin, how many times a year? 4 times a year?
4?
Okay.
Yeah.
Filler? 2 times a
Like
year?
course? Is it like, you mean like per treatment or is that just 2 syringes?
I would just say 2 times a year.
Okay. Yeah.
Yeah. I mean, because you're not doing, 4 syringes is a lot.
Yeah.
So-
I mean, like, I don't need that much.
Like,
Yeah.
I think clarifying what Roger's saying, what if they do like multiple syringes in one session? Is that fair or?
Yeah. I mean, yeah,
Okay.
it's just 2 times a year. So they were still pay, if they're doing 4 syringe, let's say they're doing a girth injection and it's $5,000, it would be 75% off of $5,000.
Okay.
But just 2 times a year. Like it's 1 and 2. So plug it all in. It's really just to kind of maximize y'all's time as well. Like, we don't want someone to be like, oh, I want to do my lips, and then I want to do this, and then when I want to do this. It's like, no, no, no. 2 times a year, like this is kind of what you get. We just want to make it black and white. Yes? Perfect. 2 times a year. And then lights and lasers. I'm gonna leave that to some of y'all. What do y'all think is appropriate? 2 times a year as well?
I don't know. That's hard because they're all so different, and so many people use different things. Like they'll microneedle, they'll halo, they'll laser hair. They're just so different. So I don't want to say you can only do pick. I don't know. I don't think that's fair. So, and then laser hair, you have to do it every month for 8 to 12 months for it to be effective. So I don't know what to say on that.
So do you want me to break it down then kind of by each laser?
Well, the reason that they made us at least pay for consumables before is because they knew that you would kind of do multiple through the year when you could. Like you can't do lasers in the summer, so people microneedle, and you can do all your stuff in the fall, winter. So they just said just cover what you're using and do what you want.
I mean, we could just say 75% off indefinitely of everything.
Yeah, I
I
would say
think that would be more fair.
Okay. Yeah. Unlimited or whatever. Unlimited. Okay.
Within reason. I mean, like if you're going in every week, like,
Yeah.
but I don't think that's gonna happen.
It hasn't been a problem.
Yeah, I think
Yeah, that's not gonna be a problem.
yeah, if it does start to, if someone starts to be super crazy, I mean, obviously it hasn't happened yet, but as we grow, we will run into somebody that is a problem, right? And it might be this person might be in Chicago. I'm not saying we're going to Chicago, but you know what I mean? Like we just don't know because there are crazies everywhere. We'll just kind of monitor it. And if in the future someone's harassing an injector about some stuff, then we'll intervene if we need to. Okay, so and then what was the other thing? B12 monthly. Yeah, okay. B12, and the last one was what else was I gonna say? Friends and family. So as a for full-time staff, I was going to suggest that they can offer this to 1 to 2 people. Or originally I said for full-time staff members, they can offer this to 2 people. And for part-time staff, they can offer this to 1 person, employee benefits or employee discounts. Do y'all think that's too aggressive? Do you hate that? Do you love that? Again, I'm just.
No, I mean, I think that's a great benefit for us to have, that we could treat our mom or significant other, you
Yeah.
know.
Okay. So full-time staff 2 people, part-time 1 person?
Yeah. Do we have to like write it down, or they have to have like a record, or
Yes.
it's gonna be on file? Okay.
Yeah, and probably what we'll do is that you can have that same person for 1 year, like, and it will reset it a year. Because
Okay.
all of a sudden, if you like, hate your sister and you're like, I'm taking her off, but you can't keep changing it. Like it has to stay the same person for 12 months.
Okay. So if you get a new boyfriend, then you can hook him up. Okay.
Or a new little side piece, you never know.
Yeah.
Yeah, no judgment. Okay, so 2 people. Also, I think a lot of people should probably use, especially for our full-time injectors and our full-time staff, they can use that as a marketing tool. So, part-time. And then it kind of gives a benefit to the part-time staff. So I kind of like that. 1 person, 12 months. All right. Last thing is, what are the benefits specifically for the injectors? Because this is y'all doing it.
I would say like free sounds good to me, but I know that's not gonna happen.
I mean, I would be okay with free if
it was samples. Yeah,
That's what I'm saying. We get them anyway.
I mean, you have to, it's either 1, you inject yourself, or 2, it's obviously another injector injecting you. And it's an agreement that it's an agreement that I'm going to inject you, you're going to inject me. And it's like, this is our agreement. I'm
cool with that.
I'm good with that.
Yeah. I mean, I think we are the backbone of med spas. So, I think we should have bigger benefits.
Exactly.
Okay, so I'm going to say free for injectors for full-time injectors.
Yeah.
Okay. And then part-time, if we bring on part-time injectors, they can go to the 75% off.
Yeah.
Okay, so full-time, 100% free. And then part-time injectors, normal employee benefits. Y'all think that's fair?
Yes.
Is there anything else that y'all want me to add or take to them? I'm going to push very, very, very hard for this. I've been taking notes. So I know this is what y'all want.
No, that's all fine, but also per recent events, make sure to get consents and
Yes.
document them in your thingy because
That's
it
the
can
other
go
thing.
very bad.
Thank you, Camille. The last thing on there is every single person, I don't care if they are an employee, if they're friends and family, they go in as a normal scheduled patient. They will schedule their appointment, they will have their assessment, they will have a chart, they will sign consents, do all of those things. They are a normal patient. This is CYA. So if you do not chart on a patient, it is on you and you are shit out of luck if something happens because you don't have any documentation. So it's a medical record. So we have to get these things. So perfect. All right. Do y'all have anything else y'all want to talk about? Comments, questions, concerns? This was fun. Have y'all ever done this? No? We should do this like occasionally and just kind of get everyone on and just kind of talk. I added the Facebook page. Chantel, if you have not joined it, please search for, it's called FMA Family. And so that's going to be, everybody is on there from front office staff to without surgeons. So there's no doctors on there. So it's just med spa. So Deal can be on there though, if he wants.
Get to, but I'll make a new Facebook for that.
Yeah. And it doesn't have to be like a real Facebook page. It's just something like, because I'm going to put education stuff on there. It's just a way for all of us to kind of connect. And it's a little bit more personable than just a large text because, you can have some additional ways to communicate on there, which is nice. And then I'll be posting some education stuff as well. But yeah, do y'all have anything else y'all want to chat about?
So like just a quick question, like do employees have to do before and afters for us? Like do they have
That's a
if
great
they get the discount?
That's a great thing that I can put in there. I would vote yes. I will leave that up to y'all.
So
What
like
do
if
y'all
they
think?
decline a photo consent, maybe they have like maybe just 50% off instead of 75. I don't know.
I am absolutely comfortable with that if y'all are.
That's good content, you know.
Jennifer, Camille, Justin, Chantel, what do y'all think?
I mean, if we're, we're scratching their back, they can scratch ours.
That's what I see. Yeah.
Yeah, I think that's fair.
Okay. Must do before and after. To get the 75% discount. Otherwise it goes to everything will go to 50%.
Yeah.
Perfect. Okay. I love that. I think that's a great idea. Okay, well, I'm going to take this to them and push hard for this because I think this is really kind of what we want, and I think this is a great start. So, and this is really how these kind of conversations should go. It needs to be open, and it needs to be all of us come together and we agree on something because this is truly what a team is like. It's communication and talking and collaboration. So thank you all for joining me. I know it is late, and Camille, I'm going to go open up a bottle of wine as well and get in my hot tub. So yay that. So, all right, guys, y'all enjoy the rest of your evening. Bye.